I must first thank you, Professor Yamamoto, for inviting me to the 42nd annual meeting of the Society for Cardiovascular Surgery. I am deeply sorry not to be able to attend, but I wish it every success, and I look forward to hearing about it from Professor Hurst and Dr. Chambers when they return to London. As many of your members know, St. Thomas's Hospital has a special association with Japan. You were the first of more than 50 Japanese research fellows to come to London and work with Professor Hurst and me. You were the pioneer. You arrived 38 years ago, speaking very little English, but you showed great enthusiasm, you worked hard, and you were very popular with your British colleagues. You worked with me in the operating room, where your technical surgical skills became immediately apparent. I had great pleasure in having you working with me. I also had great pleasure in watching you operating in Akita on complex congenital and adult cardiac cases. I was immensely impressed with your overall skill. Your excellent research work with Professor Hurst in the Rain Institute contributed largely to the development of the St. Thomas's Hospital cardioplegic solution. Your contribution so impressed us that we worked hard to set up a program so that other Japanese research fellows could follow in your footsteps. Many Japanese doctors must thank you for making their visit to London possible. We were delighted when you were appointed professor in Akita and set up such a first-class cardiovascular unit. And we were delighted when you became president of the Japanese Society and are organizing this important congress. Your clinical and laboratory research has been exemplary, and this is shown by almost 300 publications in Japanese and international journals. A surgical career, it is said, should have 3 phases. Phase 1 is learning the necessary skills, and you trained at St. Thomas's and Great Ormond Street in England and at the National Cardiovascular Center in Osaka. Phase 2 is advancing the subject, and your formidable list of publications demonstrates how you have done this. Phase 3, which is often neglected, is advancing the careers of your junior doctors. The long list of co-authors of your publications shows how many young men you have encouraged. By any account, you have had a supremely successful cardiac career. We at St. Thomas's are proud of you, Fumio Yamamoto, and we wish you every success at your meeting Kampai.